So in the general pharmacology, now let me discuss about what is called as adverse drug reactions. Right, let me discuss about what is called as the adverse drug reactions. Now, if you take these adverse drug reactions, remember these are noxious or unintended effects produced by the drugs. So these are noxious or unintended effects, right? These are the noxious or unintended effects produced by the drugs. Now, these adverse drug reactions, they are classified, and these may be classified as right, these may be classified as type A reactions. Now what do you mean by this type A reactions? Type A reactions, they are augmented pharmacological effects, right? Augmented, the word A is A, augmented pharmacological effects. Now let me tell you the example. Now you take a group of drugs which is nothing but the sulfonylureas. Right, what are these sulfonylureas? Remember, sulfonylureas, they are oral hypoglycemic agents which are used in the treatment of type 2 diabetes mellitus. Okay, so this particular sulfonylureas, whenever they are given in higher dose, they can cause augmented pharmacological effect, and thereby the individual may land up in hypoglycemia. Right, the individual may land up in hypoglycemia. So this is what is the example for your augmented pharmacological effect. Right, now your type A reactions, they are dose dependent and predictable reactions. Okay, so they are, right, they are dose dependent, and this particular actions, they are predictable. So every one of us know that if the sulfonylureas, when they are given in higher dose, they will have the hypoglycemic effect. So it is predictable effect and it is also the dose dependent effect. All right, next let me discuss about the type B reactions. Type B, remember, it is the bizarre effects. Alright, remember this, these are the bizarre effects, right? Bizarre effects or idiosyncratic. Right, or it is idiosyncratic. Now you take type B reactions. Type B reactions, they are having, B stands for bizarre, right? They are having dose independent and unpredictable effects, right? So they are dose independent and unpredictable effects. Now let me tell you the examples of this particular type B. The examples are like, you take the antibiotics, that is penicillin, right? You take the antibiotics, that is penicillin. These penicillins, they cause allergic reactions. So allergic reactions caused by penicillin, that is your bizarre effects. Okay, so allergic reactions caused by the penicillin, right? That is your bizarre effects, and it is dose independent and unpredictable effect. So that is your type B reactions. Next, we have what is called as type C reactions. Right, we have what is called type C. Type C, it stands for the chronic effects. right? This stands for the chronic effects. Now, what do you mean by this word? I mean the example for this chronic effects. Now you take the peptic ulcers, or you take the drugs that is NSAIDs. So for example, you take NSAIDs, that is non-steroidal anti-inflammatory drugs, right? Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, upon chronic use, they may cause peptic ulcers, right? Upon chronic use, they may cause the peptic ulcers. That is what is your type C reactions. Next let me discuss about the type D reactions. If you take type D reactions, D stands for delayed effects, right? D stands for the delayed effects. Now let me tell you the examples here. Now you have a drug called thalidomide, right? You have a drug which is called as thalidomide. Remember, this particular thalidomide, it can cause a delayed effect. What is that? It is nothing but teratogenicity. Right? Teratogenicity. So this is one of the delayed effect. Next, you have type E adverse drug reactions. So the word E stands for end of the treatment effects. Right? End of the treatment effects. Right? That is what is your type E reactions. Now, what is the example for this particular type E reactions? The examples, they include withdrawal response to morphine, right? Withdrawal response, right? Withdrawal response to morphine. So morphine, remember, it is an opioid analgesic. An individual who is addicted to morphine, right, they will have what is called as withdrawal response once this particular drug is stopped, and that is what is called as end of treatment effects. So once you stop the treatment with morphine, they can have what is called as withdrawal response, and that is what is called as the end of treatment effects. Next, you have what is called as type F adverse drug reactions. Type F stands for failure of therapy. Right? Type F stands for the failure of therapy. These are your adverse drug reactions. So remember, adverse drug reactions, they are noxious or unintended effects produced by the drugs, and these may be classified as type A reactions, which is nothing but augmented pharmacological effects, that is dose dependent and predictable. An example is your hypoglycemia caused by anti-hyperglycemic drugs like sulfonylureas. Then you have type B effects, that is bizarre effects or idiosyncratic, that is those independent and unpredictable effects. Example, allergic reactions caused by the penicillins. Then you have type C, that is chronic effects. Example, peptic ulcer caused by the chronic use of the NSAIDs. Then we have type D effects, that is delayed effects. Example, teratogenicity caused by the thalidomide. Type E adverse drug reactions, that is end of treatment effects. Example, withdrawal response to morphine. Then you have type F adverse drug reactions, that is failure of therapy.